I call the member for Bowman.
Thank you, Deputy Speaker. And this is an interesting debate about social security reform, coming in the context of nearly a decade of changes that were initiated by the Howard government. What we're effectively debating today is an extension of John Howard's ideas and the reviews that Patrick McClure contributed to. And it does surprise me, more than anything, the number of people on my side of the chamber that have a problem with this legislation, because I do not have a problem with a single word of it. And in debates around something as important as welfare reform, I think what Australians need to know that there is some level of intellectual and moral consistency in the way we approach protecting the most vulnerable in this country. And I would say that on this side of the House we have forged since the mid-90s, bringing the words "work for the dole" back into common parlance, where it could be uttered at a barbecue without being shown to the door, to a point now where there is an expectation that one contributes as a working-age adult, be you not incapacitated or a primary caregiver to a large number of children, as well as you possibly can. And the job of the welfare system is to engage every Australian to give an opportunity to contribute as best they can. And let's not forget the words of Noel Pearson, who said, "The more you raise the payments for inactivity, the more it becomes a welfare pedestal from which you cannot escape." Now, 10 years ago, these thoughts could not be uttered in groups of more than two or outside of a right-wing think tank, but now the world has changed. Now what we acknowledge, and Prime Minister Cameron in the UK just 2 days ago has pointed out, that we may well be moving towards a superior system where there is a single payment for those in need, adjusted simply for the needs of those that are dependent to you, or for the needs of those who may well have a disability. We need to potentially move to a social security system, Deputy Speaker, that pays a lot more to a severely disabled Australian than just a standard pension. The simple notion that when you attain a disability support pension, you're paid the same as an old age pension, and if you're more disabled than others, it's just bad luck, there's a single payment, will have to change. There will be a time where we have to tailor these payments directly to the needs of individuals. But the one thing that right-of-centre governments have worked on around the world is the proposition that everyone should not only be able to give, but the state should assist them to give as best they possibly can. And so long as you are paying $529 on a New Start allowance and $648 on a disability support pension or a parenting pension, there's very little drive to go out and do anything other than have a series of excuses why you can't work. And we are in an economy that is predominantly a capital over labour economy. There is too much capital in this country to not be utilising our labour as well as we can. We have a participation rate lower than many nations in the Northern Hemisphere. And our job on this side of the chamber is to raise that number, to hold the hand of every Australian and say there is no reason why you cannot be in the workforce. I've been privileged to employ 2 disabled people in my office, and I've learnt that a simple piece of software can open up an entire world to people who could never have dreamed of working in the office of a politician. I have 2 mums working in my office, and they never come in until their kids are looked after. And if there's a problem, they leave to look after their kids. So this is a cultural shift we need to be thinking about. There are plenty of opportunities for the people we are debating today who may well back in my electorate be saying, "I'm $112 worse off a week after these changes." And I say, not if you get a job. Because we are paying to take your kids to school through publicly funded assets to keep your kids at school and give them a great start in life. Why cannot a parent whose children are in publicly funded facilities find time to work in those intervening hours? But as long as we persist with a $529 payment and we grandfather everyone since 2006, it simply won't change until they're forced off the payment by the age of their youngest child. Now, all we're doing today is unravelling the grandfathering that Prime Minister Howard put in place to ensure that this transition from welfare to work was smoother. And it's an old and important and valuable political tool. Grandfather those who are currently potentially affected and implement it as of today. All we are doing in this debate is removing the grandfathering, removing that little political flourish that John Howard employed in 2005 to ensure that we didn't have a mass sort of protest July 1, 2006, when welfare to work was introduced, because we grandfathered parents. Well, I think in 2012 we're mature enough to say the rules that apply to parents today should also apply to the parents who in 2006 had children who were older than the age of 6 in the case of single parenting parents, or 8 in those who were partnered parenting payment recipients. There is nothing inconsistent about that. And I'm frankly a little disappointed that my side of the chamber isn't firmly behind the government in doing all of this to the letter. You cannot deny that this is an important move that we would have done if we were in government. You cannot deny that the government over here has made changes to the thresholds to make it easier to go and earn some more money as a parent and still be able to get your payments by relaxing some of those requirements around work earnings, so that the taper at $62 and $250 a fortnight moves from 60 and 50 cents down to 40. A uniform, simple taper. Everybody understands you can earn $62 a fortnight, and once you tick over that amount, it's tapered by 40 cents in the dollar. I mean, that's not hard for anyone to understand. Look, this is the basic proposition. If you are a working-age adult in this country, and I don't care if you live in an Aboriginal community or the centre of Sydney, it's a reasonable proposition. If you're not incapacitated, okay, if you have children who attend state-funded education, it's a reasonable proposition to ask every one of those to fulfil a work obligation, an activity requirement, a work, study, training test. Let's not pick on the 16-year-old and 17-year-old mums. Let's talk about every Australian doing that. And then it's up to the employment sector to find the flexibility to enable these people to engage the economy. And as long as I hear excuses, and I'm disappointed they come from my side of the chamber today, excuses about not being able to catch a bus, or having a hole in your shoe, or not having the right shirt to go to a job interview. I mean, they are the problems that I want to have as a government, because I can fix those. But the problem I can't fix is having the welfare pedestal of $5.29 a fortnight that's a blind entitlement, where the people who fund the welfare system are so separated from those who receive it that this simply becomes an entitlement, a line in a Centrelink brochure. And that's the money I'm entitled to, and don't anyone take it off me. Well, that is not a sustainable welfare system. That wasn't what Beveridge conceived, over a century ago. What we need is a tailored, individualised, case-managed welfare system that can identify a person's need individually. And as I've said, there are people who need more money than they currently get. But I've got 1,500 single parents in my electorate who probably won't be happy with what I'm saying. But I am saying to them that these rules apply to everyone else from this day onwards. All we have done in this legislation is extend Welfare to Work 2005 and then the Gillard government's 2011 changes that sought to accelerate the taper. They simply said that if you have children who are aged 13 or 14, you can keep the payments till you're 15. If they're aged 12, you can have them for another 2 years. Okay? These were thoroughly reasonable tapers, and then all we're doing now is we're exercising it in a more rapid way. Now, look, we can analyse whether this is fiscal rectitude, whether it's fiscal responsibility, whether it's trying to, fulfil a grubby political promise about a surplus next year, but in reality, it's what this side of the parliament would have done. So how can we possibly have a debate about what the right of politics right around the world has been working on over the last 2 decades? And people on my side of the chamber should be patting themselves on the back and saying we've reached a point where a government can hold their head high, left of centre, and suggest these changes. I mean, doesn't that suggest a real paradigm shift? I mean, that's something that the right can be proud of, that John Howard played a major role in. And if you talk to those 30% of people who are no longer on those parenting payments because they've either moved across to another form of payment that has a more higher activity requirement, or they're actually in the workforce. Then suddenly I have households in this country where there's at least one adult engaged in the work system, at least one adult who gets out of bed, has a shower, has some breakfast, makes sure the kids are fed and says, you know what, I've got to take you to school because I've got to go to work. And look, I'm not going to apply sort of any value judgments around the image I've just created, but I'll tell you what, the evidence speaks for itself. Everything from the Whitehall studies in the UK through to all of the world's work that indicates, through any meta-analysis, that connection to work, connection to a capability, Amartya Sen's description of these very issues means health improves, means welfare reliance reduces, means abuse of children falls. And everything is centred around a capability, because only with capability can come opportunity. I don't mean to sound like Noel Pearson, but the moment we pay flat rates of welfare, and we have so many people receiving them that we're unable to individually case manage them, then we have a system that we're simply finding is too large and it actually controls us. We must take back control and make our welfare system something that is truly tailored to those who need it most. Now, they're cheap words, but in this legislation, they're fairly simple, modest changes. And they're not changes that leave people destitute. They are changes that leave people with choices. And all a Western economy can aspire to is to provide people with reasonable choices, let the state run the economy so that jobs are available, have money there to move people if work is in other parts of the country, and finally have a system where we constantly review people who need it, and for those who are seriously and permanently disabled, we stop molesting them and asking them to go out figuratively and, chase work. I mean, that's not appropriate either for someone who seriously is long-term disabled. So in this debate around the National Disability Scheme, I hope we can weave in the elements of welfare to work and be identifying people who have a bad back at the age of 50 and have a meaningful conversation about what they can do for the next 15 years. At the moment, that's not happening sufficiently. Too often, we're relying on the medical certificates of selected numbers of providers who write certificates towards DS pensions, disability support pensions, and other doctors don't do them at all. We need a more standardised arrangement so that there's some form of national consistency. So I think all of the elements here, be it the modifications to termination payments to be fairer and more clear about how we identify end-of-work payments as far as Centrelink goes, the efforts here now to allow people to earn more money before they have this minimum waiting period for Centrelink access to be available. It is more generous. It allows more people to work and be comfortable that by working they don't undermine their payments. And lastly, and most importantly, we need to be able to look in the eyes of primary caregivers in this country, male and female, and say to them, you know what, this concept that you do one or the other has come to an end. Because we've reached a time where, in a nation so reliant on using every part of its very small labour force, we've reached a time where we must reach out and have every one of them engaged in the workforce. This bill goes a small but important way towards achieving that.